Good morning, everyone. This is Dr. Siddharth Tambar here at Chicago Arthritis and Regenerative Medicine. Welcome to our Wednesday webinar today. Today, we're talking about peptide therapy for weight loss. As I am speaking, please enter any questions you may have. If you're here on the Zoom call live, please enter your questions and I'll answer as we go along. I generally try to answer any frequently asked questions as well. If you're watching on one of our social sites, please enter your questions and we will try to answer those as well. If you're watching this in replay, you can always contact us afterwards, either through any of our social sites or website, or call us, and we're here to answer any questions. Great. So today's talk, we're talking about our physician-assisted weight loss program with semaglutide, tirzepatide. This is a peptide approach to weight loss. So in today's talk, we're going to talk about our weight loss program and how this can be of help. So I think at this point, most, if not all people in the world realize that obesity is a massive problem in our world, certainly in the United States. The sheer number of people who are categorized as frankly obese in the world is in the hundreds of millions, if not over 1 billion at this point. In the US, that number makes up 42% of adults as of 2020, and almost 10% of kids and adolescents. And this really provides a serious problem when it comes to so many things with our health. Things that we see in clinic every day, definitely musculoskeletal problems in large part that are worsened by obesity. In particular, issues in the knees, hips, ankles, and back. Obviously, folks who also have obesity have higher rates of cardiovascular issues, including high blood pressure, heart disease, strokes, all sorts of metabolic issues in terms of diabetes and hypertension. There's definitely evidence that this can also make immunologic issues worse as well, including certain autoimmune conditions like psoriasis, as well as higher rates of infection, cancer risk as well, which is shocking and very unfortunate, and sleep apnea, which is connected with cardiovascular issues as well. So we need better weight loss solutions, and they should be solutions that work in a number of ways, including, well, we'll get to how it works, but there are a lot of limitations with traditional methods. The traditional methods of diet and exercise are essential for weight loss and maintaining ideal metabolic health. But the reality is that conventional weight loss strategies have traditionally been very limited and unsustainable. And I think for those of us, as you start to get to middle age and older, you realize that on a hormone and metabolic level, your body changes. And a lot of the strategies that maybe worked when you were younger don't work quite as well as your body starts to change over time. And so that yo-yo effect is a real problem with weight loss. And so we need better options. And our goals of treatment should be not only weight loss, but changing your overall body composition in terms of body fat, improving muscle mass, reducing visceral fat, improving cardiovascular risk factors, improving your metabolic risk factors, improving your exercise, your eating habits, your immune health, gut health, sleep, all that. It is in the end all related. And if you can improve all of these things, that is truly improving your longevity in life as well. So just briefly, diet is a key part of weight loss and maintaining metabolic health. And without a doubt, the GLP-1 agonists, that's what semaglutide is a type of, they really work in large part due to helping with calorie intake. So there's 3 different ways that diet can help with weight loss. If you just eat less total calories than you're exerting, if your intake is less than your output, will lead to weight loss. Interesting thing about the GLP-1 agonists is that it's found that they will reduce overall intake of calories by anywhere from 16 to 37%, which is a lot and leads to the weight loss. And then, another kind of weight loss strategy or dietary strategy is to eat specific foods. The challenge is which types of foods. In the lay sort of public or amongst folks, you'll see that people are doing anything from full on vegan, no oil. I know a few people who do that, to people who are strictly carnivore. And so there's a huge difference. Generally speaking, for most physician societies, they'll recommend more of a Mediterranean based diet. And the reason why is that it's generally healthy for most people. It's a moderate diet, and it's one that most people can maintain. So generally speaking, a Mediterranean diet would be a diet that is higher in lean meats, less in red meats, reduced processed foods, more vegetables, and just generally a more balanced diet. And you see that really across the board amongst physician societies for not only weight loss, but for the general kind of health as well. So I think that's a good general approach for most of us to kind of what foods to choose. And then, of course, there's eating during specific times. So the intermittent fasting, the 16-8 is the most common one, where folks will start their first meal at 10 a.m. and then the last meal at 6 p.m. Makes a lot of sense. I think avoiding eating too late at night is probably the big benefit there. I think all three of these have their benefit, and all three of these can be very beneficial. Excuse me, give me one moment. Okay, great. So when it comes to peptides, this is a newer tool that we're now utilizing in health. Right now being utilized for weight loss. You're going to see this being utilized for other things as well over time. So peptides are molecules in your body that basically signal to your body what to do. So they're proteins in your body that tell your cells what to do. GLP-1, or glucagon-like peptide 1, is a naturally occurring hormone that's released from your gut that regulates your appetite, insulin secretion, and energy metabolism. So there's a number of different targets that are out there now. There's semaglutide and tirzepatide. Actually, tirzepatide is misspelled there. And then there's retatrutide, which is a newer one that will be coming to the market because it has some impressive results as well. All of these, they primarily affect the GLP-1. They primarily work as GLP-1 peptide. Some of the newer versions of this affect other receptors as well, and have some additional benefits as well. So all of these have a key role in maintaining your blood sugar kind of control, your insulin secretion. That's why it's approved for diabetes. It is also approved for weight loss and incredibly helpful for your overall metabolic health as well. So semaglutide is really the first one that's out. Again, there's tirzepatide as well. You probably hear these by their brand names, including Ozempic, Mounjaro, Zepbound. Essentially, these mimic the effect of your naturally occurring GLP-1 and has shown remarkable efficacy in improving weight loss and improving metabolic health and diabetes. So again, this works by improving your overall blood sugar homeostasis. So it's pushing the blood sugar from your bloodstream into the muscles. That's healthy. Reducing your overall transit time of food through your system as well. And also by reducing the chemicals that are normally associated with feeling hungry. And so in all of these ways, it's very helpful for overall weight loss. So by controlling weight, the big part of it is controlling it through the brain-gut interaction in terms of slowing your overall stomach emptying, reducing hunger sensations or food chatter, helping people feel fuller sooner, and just overall reducing those food cravings. So semaglutide and tirzepatide are both approved by the FDA for type 2 diabetes and chronic weight management. So for chronic weight management, it's approved for BMI greater than 30 or BMI greater than 27 if you also have another weight-related comorbid condition. What's kind of cool about that is that the things that they list are very appropriate. They're things like if you already have diabetes, high blood pressure, cholesterol, wear and tear arthritis, fatty liver, prediabetes, heartburn, like it includes a lot of different things that clearly put people at further risk. And for those of us that are utilizing this, or we're kind of excited by this class of treatments, we're excited by the future preventative indications, whether it comes to cardiovascular disease, prediabetes, if you come from a family where there's that risk, if you have neurodegenerative diseases, there's some evidence that it actually may even help in Alzheimer's patients, anti-aging and metabolic syndrome. I can tell you that I have patients who have autoimmune conditions where they're looking to lose weight, and they find that this actually helps with some of their inflammation as well. A lot of this is very much early and new ideas, but I can tell you that is where this is trending, which is pretty exciting. So all this is great. The reality is that while there's FDA indications and approvals for type 2 diabetes and weight loss, what we're talking about today is weight loss. The challenge is that most insurances are not covering it for weight loss that easily. It's a little bit harder to actually get. And as everything in our healthcare system, there may be the science, there may be the regulatory, but then there's also what does insurance want to do? That's kind of a separate thing. So the treatment protocol for these peptides, essentially most of these at this point have been dosing weekly, meaning you are injecting yourself weekly. You start on a low dose and you escalate monthly. That's very key if you want to do this correctly and if you want to avoid side effects. The reason from a side effect standpoint is that if you go too fast, your body just doesn't, like if you start too high or you escalate too quickly, there's a risk that you'll have more side effects. The other thing that we've seen is that if people go up too fast, that they may start to lose efficacy a little bit earlier than they should. And if you slowly escalate, you may not need to be on as high of a dosage to reduce side effects, and you may not need to be on as high of a dosage so that your body loses efficacy. So you start on a low dose, slowly escalate as needed and as tolerated. Monthly monitoring your weight, your appetite, observing for any side effects. I do recommend also checking your metabolic health labs every 6 months. The reason being that these treatments work very well, but they do affect the amount of intake of food and vitamins into your system. And so to make sure you're doing this safely, we have to make sure that you're maintaining your nutritional status appropriately as well. So when you look at the trials that are out there, what you find is that the degree of weight loss when you're talking about at a 1 year mark or so is roughly 15% for semaglutide, up to 20% for tirzepatide. That's on average. Some people will be a bit higher, some people will be a bit lower, but those are very realistic averages of what people should be able to expect. To really get success long term, you want to be combining peptide therapy with good nutrition, regular exercise to maximize results and to stay healthy long term. And again, when you look at the safety profile of these treatments, they're generally low risk. The most common side effects are GI, meaning some gastrointestinal side effects, nausea, constipation. Again, the way to really manage that as best as possible is, number one, make sure you're safely and appropriately increasing your dosage with your physician so you're not going too fast to help reduce those chances of side effects. And number two is, from a nutritional status, make sure that you are adjusting your nutritional habits so that you're able to get the right kind of nutrition and sustenance without really causing overdistension or issues there as well. We'll talk more about some of the potential side effects in a moment. Lipotropics are another one that we're using as well. These are essentially substances that help in the breakdown of metabolism of fat in the body, really made up of various vitamins and amino acids that are listed there. There's a lot of benefits of this, helping out with energy levels, liver detoxification, aids in weight loss, improving heart health, enhancing mood, mental clarity, just overall kind of general healthy for you. These are not going to be as strong as your peptides, but they still work. And we'll frequently end up using lipotropics along with peptides as well. It's an intramuscular injection, again, given once per week. And again, we find that if you combine that with peptides, helps with energy, helps a little bit more with weight loss as well. And the combination is kind of a nice combo. We do work with a health coaching service called Flare Health, if folks need that as well. Find that to make the appropriate diet and exercise changes that help with your overall health, well-being, and weight loss long-term, that it's thought that a new habit can take 60 to 90 days of consistently doing that. And sometimes coaching is helpful in terms of not only learning about what are the healthy things to do, but to also maintain your accountability as well. So the keys to really optimize treatment are going to be peptides plus minus lipotropics, doing the right nutrition and doing the right exercise. From a nutrition standpoint, important to eat nutrient-dense food. You need to maintain your macros as well as your micronutrients. You want to avoid overeating. It'll only make you feel more distended. But in order to make sure that you're still getting the right kind of foods, the GLP-1 agonists are great at reducing hunger cravings, so you may not be craving bad food as much as often. The reality is, though, when you're eating, you still need to make sure you're eating the right kind of healthy foods and not replacing that with foods that are unhealthy, that are not really adding to your overall nutrition. And exercise is a key part of this as well. Maintaining your overall cardiovascular health with your overall metabolic health with cardiovascular exercises, aerobic exercise is key. And then making sure that you maintain your muscle health and protecting from muscle loss and maintaining your body composition by doing regular strength training as well. That combination is still essential. Every once in a while, I'll have a patient that'll ask if they really need to eat healthy and exercise if they're taking these treatments. And the answer is yes, of course. Of course. So some frequently asked questions that we will hear. And again, please just submit your questions as we're going along. But some frequently asked questions that we'll hear include the following. So how long before you see weight loss? You may notice some early weight loss in the first month. The reality is that initial phase, your body's just getting used to something new, is really at least 2 to 3 months, 3 months where you're starting to notice some improvement. Again, my approach is you start on a low dose. That is what's recommended by the maker of these treatments as well. But you start on a lower dose and you escalate as tolerated. And the key is that if you're actually losing weight and you're tolerating it, there's no need to then go up on a higher dosage, right? Like the slow and steady is what wins the race here. So how much weight can you expect to lose? Again, based on the data, on average, 15 to 20% of body weight, depending on your goals. Some people don't need to lose 20% of their body weight, so you probably don't need to be as aggressive with treatment. How long do you need to continue treatment? What we tell people is initial period is really 6 months to see how well is it going to work, how well is it benefiting you. The studies that are out there show that peptides, GLP-1 agonists, that they are most effective for chronic weight loss management, and that staying on these treatments longer term is low risk, and that's what helps them maintain weight loss longer term as well. Again, what we tell people is longer term, you may not have to be on as high dosage. You may be on a lower dosage, less frequent dosing to maintain your benefits long term. Again, some folks will ask, do you need to eat healthy or exercise? Please, yes. Do the right things for your body. Can semaglutide make your muscles and bones weaker? Look, the reality is that when you're losing weight, your body doesn't necessarily know whether to pull from fat or muscle. It's kind of pulling from both. So, we recommend really being focused on body composition, and that includes regular resistance exercises and also optimizing your nutrition to make sure you're getting the adequate raw materials to maintain your muscle and bone health. We don't want to make another thing worse. We don't want muscle loss to increase bone loss. We don't want those kind of problems. And so the way that you have to do it is you have to do all the right lifestyle things as well to help protect your body as well. Kind of a curious question. I've had folks say that they already don't eat much. Will treatment help? I mean, it's interesting because, we focus sometimes on the peptides, on their weight loss aspect. The reality is that you don't have to take a very high dosage, and it can still help your overall metabolic health. And when you think about what leads to not only weight gain, but most of our problems as we start to become middle-aged and we have changes in our metabolism, our hormone health, all that, it's our overall metabolic health getting worse. And these kind of treatments help with that significantly. And so can still help even folks who already have limited their eating. Also keep in mind that lipotropics can also be beneficial as well. Does not affect appetite, but can still help with energy level as well as weight loss as well. Not as strong in terms of weight loss as peptides, but still helpful. So if you stop treatment, will you regain all the weight? So there's studies that have looked at this, that if you stop semaglutide in particular, and if you stop your nutrition and exercise, then you will regain 2/3 of the weight loss. What's so curious is why do a study where you stop the healthy nutrition and exercise? Like, you should probably continue that forever, of course. So my takeaway from that is maintain appropriate nutrition, exercise habits is key long term. Should you use peptides long term? Again, the data shows that people do better from a weight loss and metabolic health standpoint if they're using this long term. Those studies in terms of safety and efficacy go over 2 years now. They're actually at like 4 years plus now. Again, maintenance dosing is probably lower in terms of frequency and dosing than when you're kind of actively losing weight. And when you compare peptides to other weight loss meds that have been used in the past, what you find are that peptides, not only do they work better in terms of weight loss, but they also seem to be safer as well. And that safety aspect is key. When you look at some of the other weight loss medication that were used in the past, these were synthetic medications that were meant to have an effect on your body that may be super physiologic, more than what your body was normally doing. The thing about peptide treatments is that they're working on your body's normal system. So there's only so much that they can do, meaning that you can't really physiologically get a dramatically greater response than what your body can tolerate, because you only have, for the GLP-1 agonist, there's only so many receptors that you have for GLP-1, right? So they are safer as well because they really do work based on what your body can tolerate. So from an overall weight loss program, what we recommend is get a proper evaluation. Are you an appropriate candidate? Understand your medical history, your weight loss goals, and any underlying health conditions. Again, I would recommend doing this under a proper kind of physician management. Make sure that the team that's treating you, that they know what they're doing, they're experienced with this, they're comfortable handling when problems arise. The reality is, in medicine, we're trained to really not just handle like when things go right. We're really properly trained for when things go wrong. And so if your physician and their clinic, it knows how to handle when things go wrong, then you're in the right pair of hands. Again, I would recommend continuous monitoring and adjustment. In my experience, when people can go wrong with treatment is when they're not being monitored. I'll give you an example. My cousin is a physician. He had somebody prescribe him Ozempic, which is semaglutide, and didn't really get any guidance. He just sort of took it and just kept on escalating the dose. And so he just sort of maxed out the dose very fast. He did have a good response, didn't have a lot of side effects, but pretty quickly reached a tolerance level where it wasn't working as well. And when he looks back retrospectively, he feels like, wow, should not have really gone up so fast on the dosing, because probably would have been fine just on a lower dosage to help to lose weight in a safe manner, but also would have probably also prolonged his duration of effectiveness. And so now he needs to switch from semaglutide, he'll end up switching to tirzepatide, and will now go slower on his dosing. The other part to that is make sure you're touching base with your physician, make sure your labs are being monitored intermittently. I recommend every 6 months to make sure things look okay, that there's no signs of any side effects, and that you're nutritionally being safe and appropriate as well. To learn more about our peptide weight loss program, you can take a picture of the captcha there. You can also go to our website to learn more. Pricing is listed there as well, in case you want to learn more. Please give me just one more moment here. Okay, great. Well, listen, that is, in a small nutshell, basically what the peptides are about when it comes to weight loss. Exciting, newer treatment. When I say newer, we're still talking that's been on the market for like it's been on the market for a few years, been studied for actually over 15 years, but exciting sort of new approach to treating things in general in health. You'll probably start hearing more and more about peptide used for other issues over time. But for weight loss, it's really revolutionary and has really changed how well we can provide people weight loss and how safe treatment can be as well. If you have any other questions, you can always email, call, or contact us via any of our social sites. And we are here to assist. And until we connect again, I hope everybody stays healthy, stays warm out there, and live well. Bye-bye.